Hi, I'm Dr. Jay Cook, the Chief Medical Officer at Providence Regional Medical Center. I'd like to say a few words about the critical role that our entrance screeners have in the new COVID environment in the hospital and clinics. The COVID global pandemic has forced us into an unfamiliar and uncomfortable new reality. We continue to see high numbers of new COVID cases throughout our community and region. In Washington, every week there are almost 4,000 new cases. For comparison, that would be like every person in the town of Stanwood getting infected every 2 weeks across the state. All healthcare organizations have a primary responsibility to keep our patients and staff safe. With COVID, a big part of keeping our patients safe is to make sure that everyone entering our facilities is not at high risk for introducing new COVID infections. As a screener, you have a big role to play in these efforts. Asking all visitors about possible symptoms of COVID-19 is one proven way to decrease our risk. Requiring masks and physical distancing are other evidence-based practices. Restricting the number of people who enter our facilities is yet another way to lower the risk that one person may be the source of an infectious outbreak. We know that having restrictions on visitors to the hospital and clinics continues to be very difficult for patients, families, and our caregivers. So at the same time we take these restrictive measures, we must keep in mind that we are a mission-driven organization that must provide care for the whole person, not just their specific medical condition. As a screener, you'll be the first encounter for most people entering our hospitals and clinics. We want to always have a warm and welcoming attitude towards our patients and families who are often facing difficult medical challenges. We want to do everything possible to ease their way, especially since we will only be allowing one visitor per patient, except in a few special circumstances. We need to apply our visitation rules consistently and with compassion. Because life can be complicated, there may be special circumstances where our policies may not clearly apply or an exception should be made. In these cases, please don't hesitate to reach out to your lead or supervisor for help. Remember, you are the defensive line of our efforts to keep our staff and patients safe during the COVID pandemic. Your job is critical for us to continue to provide the best care for our community and Providence Regional Medical Center. We all need to work together as a team to succeed, so please let your leaders know how we can help you all keep us safe. Thanks so much for your dedication and work.